Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Hormones in polycystic ovarian syndrome. Hormones in polycystic ovarian syndrome include androgens. Androgens, in the presence of adipose tissue, they form estrogens. Estrogens can be E1 and E2. E1 is to E2 ratio is equal to 1 is to 1, 1 is to 2 normally. E1 is to E2 ratio equals to 1 is to 2 normally. But in polycystic ovarian syndrome, E1 is to E2 ratio equals to 2 is to 1. Estrogen shows negative feedback on follicle stimulating hormone. This negative feedback on follicle stimulating hormone, here it shows impaired follicular development. Thus, multiple small follicles are formed. These multiple small follicles show increased inhibin B. Inhibin B is increased to be more than 5 nanogram per ml. Positive feedback of follicle stimulating hormone. If there is positive feedback of follicle stimulating hormone, in this luteinizing hormone ratio becomes 2 is to 1 or 3 is to 1. Increased estrogen causes positive feedback on luteinizing hormone, not follicle stimulating hormone. Because of positive feedback on luteinizing hormone, follicle stimulating hormone is to luteinizing hormone, or luteinizing hormone is to follicle stimulating hormone ratio will increase. That is, it is either 2 is to 1 or 3 is to 1 due to increased luteinizing hormone. That is, luteinizing hormone ratio increases. Increase in luteinizing hormone ratio is not a diagnostic criteria, but it measures follicle stimulating hormone and luteinizing hormone in all polycystic ovarian disease. Now, because of increased luteinizing hormone, this luteinizing hormone will activate the theca cells of ovary, causing hyperthecosis, which results in increased androgen. Whereas, if there is no if there is increased luteinizing hormone continuously, then there is no LH surge, resulting in anovulation. So, if this luteinizing hormone acts on the theca cells of the ovary, resulting in hyperthecosis, and there is increased androgen. Luteinizing hormone surge is not there here. There is increased chance because of increased estrogen to E2. There is that is estradiol. There is increased chances of endometrial carcinoma, breast carcinoma, ovarian carcinoma, with or without non-alcoholic steatohepatitis in this patient. All this is due to an ovulation. FSH levels are normal or decreased, and there is altered luteinizing hormone to follicle stimulating hormone ratio is seen in thin polycystic ovarian disease patients.
thank you and thank you for watching.